I'm going to show you how to put on the half-face respirator. I think this is a really important skill, especially if you are somebody that's not going to be wearing this. It will really benefit you to help those that you're fit testing to troubleshoot through any issues, and it will also help you answer any questions that might come up during the fit testing process. So all of these fitting, donning and doffing instructions are a part of their e-learn for the half-face respirator. But again, you as the fit tester may not be taking that because you might be wearing a different piece of respiratory protection. So I think, again, this is really important. So I guess the first thing I just want to point out is when they receive their half-face respirator, it's probably going to be with you. And it just comes in this baggie-like device. They should not store their half-face respirator in this packaging. It does need to be stored between uses, either in a paper bag or it can be stored in a vented, covered plastic container that's available through our normal ordering process. And that's just to facilitate drying. It has the model number and the size on the packaging, just kind of FYI. And the other thing that I think is important to know is the filters come in their own separate packaging. They do not come with that respirator. So most likely they're going to have to assemble their filters on when they come to you and need that fit testing. So one of the things I just want to point out, so each of these respirator sides has this red gasket that I believe we've already talked about with these notches or tabs, I guess I would say, and then there's corresponding notches on each filter. And it's just a quarter turn. So basically you're lining up the notches with the tabs, and it's just a quarter turn. Funny enough, I don't know why, but one side, which I believe is the right side, you're going to turn up, and the left side is the opposite. You're going to turn it down. Why? I'm not quite sure, but that's just kind of how they made it. So it'll look like this when it's assembled. If the person you're fit testing is wearing glasses, this would be the part where we would want them to remove their glasses. So have them take them off. And I would say in 99% of circumstances, their glasses should work with the half-face respirator. So I think we've seen a lot of people putting this on so that the face piece and the tip of the face piece is actually way up high. And that's not how these are worn. I think maybe part of the confusion is that because the measurement that's taken for the respirator is from the chin to in between their eyes, I think that's what's causing maybe some of the confusion. So just keep that in mind. So basically the top of this respirator should sit, I guess the best way I can explain it is where the little bone starts in your nose approximately. Obviously our goal is to get a good seal, but again, it really should be seated in a spot that's going to cover your mouth and nose, get a good seal, and allow you to wear your glasses. In the event that somebody is not able to get that proper seal with any of the sizes and or they cannot wear their glasses with it, they would need to wear a PAPR or a capper. Okay. Or an N95 if your site has them available. Okay, so the first step would be to have them put it on their face. And again, we want to think about that proper positioning. And just like with the N95 respirator, it's the top strap first. And then I'm going to do the bottom. Now the bottom hooks, okay? So you can see it's like this, okay? So I'm going to pull this behind my neck, and I'm going to clasp it. Now, as you can see, this top piece is right at the crown of my head, and the back piece is at the base of my neck. That's exactly where we want it, just as with your N95 respirator, okay? Now my job is to make sure my straps are not twisted, so you might have to make some adjustments. And then, sorry there. And then tighten till it's comfortably tight. So this should never be uncomfortable. It should be just snug, okay? If you need to tighten it, it's simply a matter of just pulling on the straps that need tightening. If it needs loosening, you're simply going to push this tab out and then pull the strap the opposite way. Might be easier to show this way. There you go. Okay. So once they have it at a comfortable, snug spot, then if they're wearing glasses, they should put their glasses back on. And then they're gonna do their fit check. So you can see here, still able to wear my glasses, comfortable. The fit check is always going to be done before they enter the room with the patient, so this is a good time to remind them. And now, before they do their fit test, because we want to make sure they have a good seal before that fit testing occurs. Okay? So to do the fit check, they're going to take a gloved hand and put it in front of this exhalation valve. And they're going to breathe slowly out. Okay? And what during that time they're looking for is feeling leaks. If they do the fit check and it bulges slightly but there's no leaks, that's considered a pass. So now you just saw my hair blow, right? So I obviously have a leak on this side. If they have a leak, they can try snugging it up a little bit more, but we don't want it to be uncomfortable. So if they end up tightening it and it's uncomfortable, then we would want them to go to another size so that they could get that comfortable fit. Okay, so let's try it again. Still leaking, so I would need a different size. The other thing that's a real benefit to wearing glasses is many times if you have a leak, your glasses will fog up, so that's actually really helpful. So now it's time to take it off. I've done with my fit testing, or I'm done with my patient. We'll pretend that I passed the fit check and everything was good. So I'm going to do the bottom strap first, okay? And then the top. So I probably would have taken my glasses off first, right? And then we're good to go, and you would disinfect it between uses as following the procedure. If you have any questions or difficulty, definitely reach out to our department and we'd be happy to troubleshoot with you.